What causes acid reflux in babies? What are the symptoms and also the causes? In the next few minutes, we are going to answer those three questions. This is where we talk about the basic medical information making a difference. How? Maybe you have come across something which you have never seen in a baby. When you get this information, you will be able to know what is happening to the baby and what you can do to manage the condition. For the returning subscribers, thank you so much for always checking on this channel. And for those who have come across this channel for the first time, kindly consider to subscribe. My name is Rebecca Morangi. Acid reflux, or what we call gastroesophageal reflux, is very common in young babies. Up to 3 months, at least around 50% of the babies show up the symptoms of acid reflux, and especially spitting. When you get up to 4 months, the number increases. Going to 7 months, the percentage or the number starts to decrease. Up to 10 to 14 months, the number decreases. The reason being, you remember we mentioned in the last video, and for those who have not checked on this channel, go back, watch the last video we did about acid reflux in babies. It's like a series. We are connecting the same today, looking at how common it is, the symptoms and the causes. We said gastroesophageal reflux or acid reflux goes away at the first birthday of your baby. And that is why we are saying the number decreases between 10 to 14 months. Some babies experience or show the symptoms of gastroesophageal reflux disease. We looked at the difference again on gastroesophageal reflux and gastroesophageal reflux disease. When we mention of gastroesophageal reflux disease, this is where the condition becomes chronic and affects the esophagus of your baby. When you look at research, most of the researchers don't really know what causes Gerd. When we mention of gastroesophageal reflux, which is acid reflux, it affects most of the babies. It's very common and it's not harmful. But when we mention of gastroesophageal reflux disease, this is a chronic condition which damages the esophagus of your baby. So sometimes most of the symptoms could not really point or does not really point us to a baby having gastroesophageal reflux disease. It can lead to a different medical condition which needs to be investigated. Researchers do know that most of the babies who have gastroesophageal reflux disease are those who have what we call a hiatal hernia. This is where part of your stomach pushes through the diaphragm muscle. That is one category. And another group is those who have a condition or a disorder which affects the brain or the nervous system. Babies who have a condition we call epilepsy, they are mostly affected by these symptoms of GERD. Those who have a condition we call asthma, babies who are asthmatic. And remember we mentioned there is a connection between asthma and acid reflux. Babies who have what we call cystic or cystic fibrosis. This is a life-threatening condition which mostly affects the lungs and the digestive system. Babies who are born prematurely. Lastly, is where a baby is born with a condition affecting the esophagus. So that category mostly are affected. They are mostly affected by this condition. That is as per the research. What are the symptoms of this acid reflux? Number one is what we call spitting and vomiting after feeding. Another symptom is feeding which takes a long time, and it's mostly affected by spitting occasionally. Some of the babies have got these gastroesophageal reflux symptoms which does not affect their weight. Remember, we mentioned in the last video, this spitting and vomiting makes your baby to have what we call poor weight gain because your child cannot take in the required nutrients. Now, gastroesophageal reflux, most of the babies, it does not really affect their weight, which is a different case in gastroesophageal reflux disease. On gastroesophageal reflux disease symptoms, one is spitting and vomiting, which is forceful. Another one is discomfort, or your child becomes irritable. Another symptom is babies refusing to feed from the bottle, not gaining weight or growing. This is where the difference comes. If the baby is spitting and vomiting, which is forceful, meaning most of the nutrients, actually they are not retained by your baby for the baby to get the required weight, for the baby to grow up healthy. So this one affects the weight of the baby. Another symptom is vomiting. Sometimes you can see blood on this vomit. Some babies have difficulties in swallowing. That is another symptom. Others cough in the middle, or when you are feeding your baby, the baby coughs most of the time. There is another symptom we call noisy breathing, or in other words, we call it stridor. This high-pitched noise comes up when your baby is breathing in or breathing out. The last symptom is what we call hoarseness. What causes acid reflux? The cause is common or is the same to even adults, but the difference is the muscle valve connecting the esophagus and the stomach of the baby is not fully developed, or it opens when it should not. The muscle valve is what we call lower esophageal sphincter, what we call LES, lower esophageal sphincter muscle. Actually, it tightens the junction between the esophagus and the stomach. This muscle valve is ring-shaped. The muscle valve relaxes to allow food to enter into the stomach, and it tightens to prevent food from flowing back to the esophagus. Like another muscle, which are which is developing in your baby. This muscle also has not fully developed. Again, food and acid in your baby's stomach can press on this muscle, which will force it to open up. And sometimes when your baby changes the position of upright position and then lying down, this can also cause this acid reflux in babies. Apart from other causes, which we mentioned of the type of food we are giving the babies, this is the major cause of acid reflux in babies. Up to this point, I believe you have gotten something. You have looked at how common is acid reflux in babies, and we have looked at the symptoms of acid reflux. And remember these symptoms, there is a slight difference on gastroesophageal reflux and gastroesophageal reflux disease symptoms. And finally, we have checked on the cause of acid reflux in babies. Thank you so much. Let's continue learning together. Kindly give the video a like. In the next video, we are going to see how this condition is diagnosed in babies, how it's managed, and how you can prevent this condition. We are going to answer the 3 questions in the next video, so don't miss. Give us your experience. Thank you so much. I love your company. Let's meet in the next video, and bye-bye.